Welcome to Prevention Through Connection. I'm Kathy Samuels, Project Director for the Manhasset Community Coalition Against Substance Abuse, also known as CASA. Since 2001, CASA has existed as a resource to reduce youth substance use. We strive to reach youth before they are in trouble by connecting parents, youth, school, and community as partners in our common goal. Today's program addresses the prescription drug epidemic and how it can be prevented. With us is Steve Chassman, Executive Director for the Long Island Council on Alcoholism and Drug Dependence, also known as LICADD. Mr. Chassman holds a Master's in Social Work from the University of Pennsylvania and a bachelor's degree in Sociology from New York University. Since 1995, he has served as a clinician and healthcare advocate for individuals and families with mental health and substance use issues. His experience includes serving as director of various mental health and substance abuse programs, including Family Service League's Co-Occurring Disorder Program, Círculo de Hispanidad, Samaritan Village, and Housing Works. He has worked at LICADD for over 8 years and is a member of Manhasset CASA's Drug-Free Communities Coalition. Welcome, Steve, and thank you for joining us here today on PATV.
Thank you, Kathy, for the introduction and for the invitation to partake.
So prescription drug misuse, whether it's by teens or adults, it seems to be everywhere. We see reports of illegal activities as well as families and neighbors experiencing the loss of loved ones from drug overdose. Can you tell our audience, how did this epidemic begin?
Well, first off, not because you or I say we're in the midst of a national epidemic. According to the data from the Centers for Disease Control and the National Institute of Drug Abuse, over the last 15 years, not only the use, misuse, abuse, and ultimately dependence on prescription meds has increased exponentially, but fatalities around prescription drug overdose have not doubled, not tripled, but quadrupled in the last 10 years. So this is a bona fide healthcare epidemic that's happening nationally. We've not been immune in New York State, and certainly Nassau County has seen over the last 3 to 5 years more than 350 Long Islanders, give or take each year, who have lost their lives as a result of prescription overdose. So this is not the first drug epidemic that we've seen, but it's certainly among the worst. Where it is really crossing all socioeconomic bounds. There's many contributing factors to any public health epidemic. First off, you have to have a disease. So the disease we're talking about is substance use disorders. You should know there's a book in our field called the Diagnostic Statistical Manual of Mental Disorders. Everything that's in there that afflicts the human mind, right? So substance use disorders is a psychiatric condition, much like depression, schizophrenia, other psychiatric conditions. There is an onset of substance use disorder, and like any disease, from cancer to diabetes, there is a progression, and left untreated, as we say in the field, can result in jails, institutions, and unfortunately, for more than 50,000 Americans last year, death. So there's a couple of contributing factors with the prescription drug crisis. Without getting overcomplicated, there's acute pain and chronic pain. Now, the one thing we know in the addiction field is, yes, opioids were created for physical pain, but you know what else they mask? Emotional pain. And as the world has changed exponentially since 1996, 20 years, 2016, we've seen a post-9/11 world. We've seen the economy coming out of the greatest recession. We've seen a war on two fronts for 15 years. We've seen the digital and technological revolution. So maybe it is no coincidence that America is struggling with pain management, emotional pain management, and they're widely abusing medications that tend to sedate or anesthetize all types of emotions.
What else is going on? Yeah. So people are misusing medications. They're taking more than prescribed. They're taking for reasons other than what is prescribed, as well as sharing and taking others' medications. And I think we've been seeing a lot of that in the newspapers, where folks are purchasing them illegally. Yeah. Doctors are prescribing them illegally. But you mentioned earlier, why are people taking these prescription drugs? What is going on, especially with some of the more common ones? If you can let our audience know, which are the drugs that are happening today with the opioid epidemic?
Mm-hmm. Well, first off, why do people take drugs? For the same reason people emotionally eat, for the same reason people gamble, for the same reason that people act out in a host of ways. Ultimately, as human beings, we're trying to feel better. So we're not advocating for substance use, but make no mistake about it. These are very powerful drugs that release large levels of dopamine, which is the pleasure chemical in our brain. So whether it's marijuana or whether it's opiates or whether it's cocaine or whether it's a whole host of prescription meds, all of these drugs produce change in mind and mood. Unfortunately, in the long term and not even beyond short term, they're not effective as a healthy coping skill for anger, for sadness, for stress, for anxiety, for fear. So there's a host of reasons that human beings act out. Ultimately, we're trying to feel better.
So which drugs are you seeing, whether it's teens or young adults or even adults, misusing more often?
Well, over the last 10 years, it's been overwhelmingly prescription opioids. And we've seen here on Long Island, we've seen across the country, no shortage of doctors that despite their medical license and training, were prescribing an exorbitant amount of opioids. To get 100 Percocet or Percodan
for a tooth
with 5
extraction.
refills
Yeah.
is absolutely ludicrous. And I'm not saying all doctors that overprescribed. I think the medical community was kind of misinformed as to what the addictive properties of these drugs were. Also, in some cases, they were trying to work with managed care, which is really managed cost, and insurance companies. So overwhelmingly, they were trying to help people, but inadvertently, they walked people down the dark road of abuse, misuse, and ultimately dependence. Keep in mind, opioids, all drugs run the potential for psychological dependence, but opioids also bring the added component of physical dependence, which means if you don't continue to take them, they're actually physical symptoms or withdrawal symptoms that an individual experiences, not only in mind, but in body.
And with the opioids, we're also seeing across Long Island the heroin use that is going on. Can you explain to the audience what is that link between the prescription drug opioid and the progression towards heroin?
Well, over the last 10 and 15 years, we've seen opioid dependence increase exponentially, as we talked about. And there have been families who have lost children. There have been families and communities who have lost loved ones. And advocacy groups like LICADD, like FIST, Families in Support of Treatment, and a host of other advocacy groups that have made it our business to go to both county executives, to go to Albany, to speak to our state legislators. Something needed to be done to curb these practices of overprescribing, the practices of individuals going to various doctors and not having a real-time database. And what came out of that advocacy was a law called iStop, the internet system to track overprescribing. And it cut down on an individual's ability to doctor shop, to go to 3 doctors in one day with a real-time database. And it also cut down on unscrupulous prescribers. And we've seen several Long Island physicians go to jail because of unscrupulous practices, selling pills for cash. So as that prescription medication supply began to dwindle because new ethics and regulations were in place and enforced, like squeezing a balloon. Some people ran to LICADD to get referrals to detoxes, inpatients and outpatients, and treatment for their substance use disorder. And other people made the leap, unfortunately, to street drugs, like heroin. Now,
So talk a little bit about that chemical makeup between the two drugs, because a lot of people, you know, well, I'm taking a prescribed drug, it must be safe, I'll never become a heroin abuser, but that is happening. Explain the connection chemically, if you can, to the audience.
Opioids are opioids. So we're not going to get, I'm a healthcare professional, so I'm not really going to get into legality or illegality, licit or illicit. But the fact is that heroin, which is a trade name, was synthesized from morphine. Morphine is an opiate, and is really the derivatives of what makes up these powerful prescription opioids. They're derived from the opium, or the poppy plant. Heroin is a synthetic opioid. So it is illegal. It has been illegal since the early 1900s. It was synthesized heroin by Joseph Baer, who's a German pharmacist. It was meant for veterans that were coming back from the Franco-Prussian War. And it was a very highly effective painkiller for physical pain. So long story short, currently heroin is illegal, so therefore we have cartels and black markets that sell heroin. What people who sell heroin did over the last 15 years, because they lost their market to American pharmaceutical companies who were buying prescription opioids in prescription pill form, what they did over the last couple of years was increase the potency of heroin on the street. So it's very cheap, and unlike the last heroin epidemic we've seen in the 70s, where it was 40–50% pure per bag, now it's 80 and 90% pure. And if that wasn't enough, the cartels have actually realized that they can even make it more potent by including derivatives of fentanyl, which has only increased the overdose rates.
Right.
So there have been national warnings of people who use heroin. And unfortunately, some people had to make the leap because, remember, this is a very powerful, physically and psychologically addictive drug. People are willing to sell jewelry, their parents' laptop computers, and ultimately themselves for the next fix.
So now fast forward to today.
Sure.
We have the iStop legislation in place, and there's limited prescription drugs going on the street, technically.
Ideally, there should be, but yet we still see Long Island.
Seeing it.
Yet we still see Long Island and New York and American physicians being put in jail as a result of unscrupulous prescribing patterns.
Still doing it.
But make no mistake about it, a substance use disorder or opiate dependence is an extremely powerful form of obsession and compulsion. Right. Obsessions are recycled thoughts. I need another. I need another, and they lead to compulsions, which are repeated behaviors. And make no mistake about it, the dopamine surges that happen as a result of heroin and other opiates are in the hundreds of thousands of range. To say it's unnatural to feel that good is an understatement.
Right. You know, and I want to even make comment to the audience that the Journal of American Medical Association just came out that even our youngest children, you know, younger than 5, we're seeing overdoses because the children are getting access to people's drugs in the home, which is, I wanted to just talk briefly about that before we take a quick break, about how young adults are accessing prescribed drugs without a doctor's prescription.
Well, first off, this is the digital and technological age. I don't want to encourage our viewers, but you can go online and you can order drugs from outside the country with a credit card. Remember, you're supposed to buy drugs that are approved from the Food and Drug Administration, but that also fed some of the misnomers that young people said, well, if it's in my parents' medicine cabinet or my friend's parents' medicine cabinet and there's a doctor's name on it, it must be okay. The problem is that young people, particularly adolescents, have no idea the potency or the drug interactions with this and marijuana and alcohol. Unfortunately, it's making a lethal elixir.
Talk about briefly the health risks associated with taking prescription opioids without a doctor's prescription. Well,
first off, you don't know. When someone has physical pain and opioids are prescribed, it actually offsets the chemical we have naturally in our body that causes pain. So if you get a tooth extracted and you take opioids as prescribed, your tooth doesn't hurt for X number of hours. In the absence of that chemical of pain, huge floods of dopamine, which is a neurochemical in our brain, flood, and we experience euphoria, a feel-good feeling. So it's particularly dangerous that, you should never take medications that are prescribed by a doctor and taken as prescribed by a doctor. And quite frankly, once you start self-medicating, and there's the word, Kathy, and you and I know it well, once you're taking medications to self-soothe for emotional unrest, for fear, for anxiety, for sadness, or maybe even for socialization. Let's face it, we all do that from time to time. I'm not saying with drugs, but we all want to be able to socialize well, right? There are extreme dangers. When this starts in adolescence, you are actually beginning a behavioral pattern that likely you will take into adulthood. That when I socialize, I take these drugs. When I feel sad, I take these drugs. When I experience anger, I take these drugs. And as those patterns take hold and we move into adulthood, they can actually exacerbate some of the negative consequences that come because it's not healthy. As a healthcare professional, I'm not interested in legal or illegal, although I encourage everyone to stay within the bounds of the law. The truth is that self-medicating with drugs, including alcohol, including marijuana, or self-medicating with prescribed drugs that weren't prescribed for you is extremely slippery slope and dangerous for behavioral patterns that can happen not only in the long term, but almost immediately is what we're seeing.
Right. From overdose to
absolutely.
Addiction in the long term. Thank you, Steve, for your insight to the prescription drug epidemic in our communities. We're going to take a short break right now, and when we come back, we'll be talking to Steve Chassman about what we can do to prevent prescription drug misuse, especially at home and in our communities.
Prescription medications are an important tool healthcare professionals use to help people feel better. But when used in the wrong way, they can be just as harmful as they are helpful. Unfortunately, millions of people in America misuse medications, and thousands do so for the first time every day. This can lead to serious legal, social, and health problems, with drug overdose representing the leading cause of accidental death in the U.S. So it's easy to see how prescription drugs can be dangerous for you and your family if they're not used and handled safely. These risks apply to everyone: teens, college students, working professionals, seniors, and even children. There is no particular type of person that misuses prescription drugs. It can happen to any of us. And while it's true that some people do it intentionally, it's often the case that people misusing prescription medications aren't doing it on purpose. It could be an older adult accidentally taking their prescriptions differently than prescribed, or a parent who hasn't properly stored pill bottles out of reach of a curious child. Oftentimes, it's a person that's become dependent on pain medications after an accident, or even something as routine as a dental procedure. The good news is that all of these situations can be prevented, and that's just what we've set out to do. We're Generation RX, an educational initiative that's been promoting safe prescription medication practices in the community since 2007. Our mission is to educate people of all ages about the potential dangers of misusing prescription drugs. Today, Generation RX is being embraced by families, teachers, caretakers, and community leaders. Healthcare professionals are also using Generation RX to better educate their patients. Our tools are designed for everyone. Our free online resources raise awareness and provide guidelines for preventing prescription drug misuse. They also help bust common myths about safety and legal issues. These ready-to-use tools are perfect for educating yourself and others on safe medication practices. You can use them at home, in schools, in the workplace, at senior centers, or just about anywhere people should know about medication safety. Start making a difference in your community by clicking Take Action on our homepage. It's the first step you can take towards safe medication practices for life, for yourself and others. Medication safety starts with you. And be sure to share GenerationRx.org with your friends and family. Generation RX, safe medication practices for life. Brought to you by the Cardinal Health Foundation and the Ohio State University College of Pharmacy.
Welcome back to the second half of our program with Steve Chassman, Executive Director of the Long Island Council on Alcoholism and Drug Dependence. I would like to turn our focus to what can families do to protect their loved ones from the prescription drug epidemic. In particular, can we talk about safe medication practices?
Well, absolutely. First off, if you're a parent and you're dealing with a child or you're dealing with an adolescent or even a young adult, it's important to escort them to, or at least have communications with the physician to make sure that they're not being overprescribed. For instance, I have a friend and he escorted his daughter and she had a tooth extracted and she was 15 and they were very quick to prescribe opioids. And given what he knows as an informed parent, and CASA, LICADD, there are a whole bunch of agencies that are out there making sure parents have the necessary information at the height of a drug crisis. Is there an alternative to opiates? We're talking about acute pain, that it's in the short term. Do they need 50 Vicodin for what could very much amount to 2 days of discomfort, and will Tylenol work?
Right.
Beyond that, making sure that prescriptions are secured. Parents have said to me, are we really at the point where we have to lock up? Yes.
Yes, we are.
We're in a national crisis. And even if it's not your child, it could be your child's friend. It could be the person remodeling your kitchen that are rifling through medicine cabinets or rifling through jewelry boxes, looking for resources in pills or in cash to fuel what is this national epidemic. So very important. Lock boxes for prescription meds. Doing medication drop-offs. Each of the local precincts in Nassau and Suffolk, many have drop-off boxes. You can have, Shed the Meds.
Right, we do Shed the Meds. We work with the town of North Hempstead's STOP program. And one of the things that our Cardinal Health Safe Medication Practices for Life grant is also promoting is the fact that in Nassau County, all of the police stations have the ability to take unwanted medications. And a number of the local police precincts do, the departments, the local village departments. But one other thing I wanted to just briefly talk about is modeling. How can parents model safe medication practices in the home?
Well, listen, if you're prescribed medication, whether it's benzodiazepine like Xanax or Klonopin, or opioids for chronic pain, we have to model sound behavior. It's not saying don't take your medication as prescribed, but is the economy size medication bottle by the bananas at the end of the island in the kitchen? You know, we have to ask ourselves also, is the vodka right next to the Ben & Jerry's in the freezer? I mean, all mind and mood altering drugs at the height of this crisis, if we're modeling good behavior, need to be secured. That's not to say adults can't indulge in alcohol or other drugs if that's their thing, not that we condone that, but understand that our children...
Other prescribed drugs.
Right.
But under a doctor's supervision.
Agreed. But make sure that, and everyone knows this, young people, particularly with the digital and technological age, are more they're absorbing more information than ever before because of the internet, but they are very much in tune with what they're seeing adults do.
Right.
So,
and the other thing is that, you know, a lot of family members will often say, if you have a headache, do you want to borrow my medication? You know, those were prescribed by the individual, for the individual with a specific person, and I think in today's day and age, you know, we're very quick to think that a pill can solve our problems. And it's safe. Again, if somebody else is being prescribed that medication, we don't want to give it to somebody else because it's not for them. And the doctor specifically provided it to you based upon your age, your weight, your condition. You talked a little bit about the internet safety piece, and you know, we know from our friends at the Nassau County Police, as well as other experts in the field, importance of parent supervision in the home when it comes to the internet. Can you talk a little bit about that piece in terms of parent communication with their children and how that can help kids make healthier decisions later on when they're faced with these difficulties of navigating adolescence?
well, first off, is to be informed. I mean, for many of us who grew up in the 60s, 70s, 80s, or 90s, the society has changed. The drug culture has changed. And even if you may have known people and they turned out okay, these are not those drugs. This is not that generation, and the world has really changed exponentially. So how people perceive drugs, and the national debate is on, right, as we contend with legalization, marijuana, medical marijuana, you know, the national debate is on is what role drugs are going to play in society. Parents need to be communicative with their children about the dangers of really engaging substance use at a young age. I also think boundaries are important. More so than ever before, we find parents who, you know, want to be, yes, friendly, you know, with their children, but you know what? Adolescents, younger children, from 0 to 21, and really adolescence goes to 25, they need guidance. They need restrictions. Not to be so punitive, but to be informational. Do you know what these drugs do? Do you know what some of the side effects are? Do you know what some of the drug interactions are? Everything from alcohol to prescription meds to marijuana. I mean, we have to have open dialogues about this. And we're not saying, oh, you know, you should have the drug talk. There's a national epidemic that's taking the lives of Americans at never before. We've seen other healthcare crises. You have to inform people about what the disease is. If the family has a family history, there's an old saying, you know, shake the family tree and down comes the bottle. Sometimes there is a genetic predisposition to this obsession and compulsion, and if there is a family history, to be upfront and honest. Parents don't have to fall into that that zone where, well, if I indulged when I was younger, what happens when they ask me? You know what? You get to play parent. You don't have to self-disclose. All you have to tell them is what the expectation is and what the restrictions are. And if you can offer them that guidance from 0 to 20, 21, they can clear the red zone, which is adolescence.
Right. And I want to also, within that time frame of adolescence, making sure kids have healthy coping skills.
Absolutely.
Can you tell our audience a little bit about the importance of healthy coping skills as opposed to the tendency we have across our country to take a pill to feel better? The pill is always going to solve our problems.
And, you know, there's a reason for that, too. And we're coping with the emotional spectrum. Mad, glad, scared, and sad, and the thousands of emotions that happen with us on any given day, on any given week, and any given year. So in order to be able to cope with emotions, there are basically 4 basic ones. And it's not emotional eating, and it's not substance use, and it's not self-medication. Exercise, the greatest reducer of stress. Being able to communicate with a trusted parent, a trusted professional, school-based professional, a clergy person, or a friend. Very important. Being able to slow down the mind. Nowadays we call it mindfulness. Being able to just enjoy maybe the great outdoors.
a little bit about mindfulness and what the purpose of mindfulness is, because we do work with our youth at Manhasset High School with mindfulness, and LICADD delivers those programs. But what's the value of mindfulness?
You know, it's like our computers. Young people understand this analogy. When your computer has too much process and display and saving information at once, it crashes when it doesn't have enough time, much like the human mind. When we're processing too much information and we're under too much stress, and it's a very competitive school year, and there's social interactions, and now I have the internet and I'm plugged in 20, if I don't take time to just settle down. You know, we're so industrious as a nation, and young people today are moving at a rate, and adults too.
Right.
But you know what we've lost? The art of non-doing. To be able to appreciate where we are, what we have, and what we're experiencing right now.
And slow down and enjoy that moment.
And that gives you more insight into not only your external landscape, but also how am I feeling right now? And what could I do when I experience fear? What could I do? You know, sometimes the best thing is to do nothing, just to sit.
Right.
You know, we have an old saying in America, if something happens, just sit there, do something. But mindfulness says, just don't do something. Sit there.
Sit there, relax. So parents can take out help their kids with healthy and coping skills, but I want to just roll back real quickly to what happens if kids are abusing drugs and parents are for the first time saying, oh my gosh, you know, I think something's wrong with my child. Who can they go to for help here?
Well, first off, parents will know. If you know your child and friends know their peer group better, if you see physical, psychological, interpersonal, friends and family, if you see dysfunction in these life, school, when the A student becomes a D student or the B student becomes an F student, there's an old saying, if you're not working on something, something's working on you. With any disease, from substance use disorder to diabetes to cancer, God forbid, early intervention is key. More times than not, we're seeing these signs and symptoms of substance use disorders in adolescence. I'll tell you, at LICADD, we're seeing 1,000 people a month. Disproportionately, they are young people from 13 to 25. It usually starts junior high school, young adulthood. We don't see too many people that walk in their 30s and 40s and say, I started experimenting with drugs in my 30s and 40s.
Right.
These behaviors start very young, and if you see dysfunction, or if you're assuming that there's substance use going on, agencies like LICADD, we are very rich in resources here on Long Island. Early intervention is key, if nothing else, to have a non-judgmental, engaging educational session with a young person.
And LICADD can help parents. You're open 24 hours a day?
Well, we have a 24-hour line, and we're open 6 days a week. We have 4 offices in 2 counties. One right here in Nassau is our executive office. Lots of opportunity to engage our clinicians. We could be reached 24 hours a day. And our website, we're doing interactive stuff online now, so young people don't even have to leave their house.
A lot of resources on your website. So real quick, to who can kids go to? Teens, if they can't talk with their parents and they are having a problem, what kind of where can kids go for help?
Well, I think LICADD we have a very engaging clinical team. Many of them are in their 20s and 30s and still speak the language of adolescence to be effective. We speak to 30,000 students a year, so that's just one resource. More and more, though, Kathy, we're seeing, because of the ongoing crisis, when you have high school students that have lost 3 and 4 friends to overdose across Long Island and across the country, peer groups are forming. Certain schools have natural helpers that they can identify maybe signs and symptoms of substance use and or other mental health disorders and steer them or gear them to the healthcare professional, to the school-based professional, to someone, to an adult, to a parent that can actually put them in the hands of trusted professionals so assessments can be done and hopefully appropriate referrals to treatment, whether it's detox, inpatient, outpatient, or mental health treatment.
And teens can also talk with teachers, guidance counselors, principals, whoever it is that's the important adult in their life to gain help.
And I'll say this is how you stop healthcare epidemics, is that everyone pitches in, not just school-based professionals and healthcare professionals, but adolescents and parents and clergy people and legislators and police. Everyone pitches in, and fortunately we're starting to see that.
Right, and that's the work of our coalition, is working with everyone to help kids make healthy decisions.
And you do it well.
Thank you, Steve, for being with us today. Our time is up for today's program, and we want to again thank Steve Chassman for his work in substance abuse prevention and for working with us here on PATV. In closing, Manhasset CASA reminds viewers that prescription medications can help us to lead longer and healthier lives when used under the supervision of a healthcare professional. But these powerful, sometimes life-saving medications can also be harmful, especially when misused. We hope today's program has been informative about safe medication practices and the prevention of prescription drug misuse. Manhasset CASA encourages all residents to dispose of unwanted medications at local pharmaceutical take-back events, as well as any Nassau County Police Department precinct, as close to 70% of teens who abuse prescription drugs access them through friends and family. For additional resources about prescription drug misuse prevention, go to manhassetcasa.org or LICADD.org. Until next time, this is Kathy Samuels from Manhasset CASA, wishing you and your family a healthy and safe tomorrow. Thank you.